Hi everybody, this is Ash, your buddy and your fellow nurse, and today we'll be talking about opioid toxicity. And what is opioid toxicity? When a person takes a lot of products that has opium in it, it depresses the respiratory system and it also affects the conscience of the patient. When a patient like that comes to you and they'll be unconscious, maybe semi-conscious, and they will be breathing less than 10 breaths per minute, that means we suspect them from opioid toxicity. There are also differential diagnoses like hypoglycemia, but for that you will check their blood sugar level. If it is more than 4, then they are not suffering from opioid toxicity. They are not suffering from hypoglycemia, they are suffering from opioid toxicity. So imagine there are receptors and opium works on those receptors. They slow down the breathing. And to combat that, we have opioid antagonist. We call it as Narcan or Naloxone. What Naloxone does is it goes and sits on the receptors so that the opioids cannot work on it. And when you find a patient like this is an emergency. You will have kits like this to use. I feel like we have all seen this kit, but we have not opened this because we have never come across a situation where you have to use this. So I'm opening this for you just to show you how it looks like, and you will get 2 naloxone kits in this, which each is 4 milligrams. Once you open it, it comes with instructions if you do not know how to use that. But the first instruction is to try to rouse the patient. You can rub their chest as a nurse and you can try to wake them up. If they are not waking up, they are semi-conscious or maybe unconscious, and their breathing is less than 10. Please do not forget, if the breathing is less than 10, then we go for a dose of naloxone. So we put them in a position, or you can put them in supine position if they're on the floor. Most probably they would be. And then you put this called the nozzle in their nose, and what you do is you press this. This is an expired one, I'm not going to press this, but when you press this, it goes up and it delivers a dose of Narcan or naloxone, and then you wait for 2 to 3 minutes. If the respiratory rate is not more than 10, that means it's time for another dose. Also, I would be calling 911 when I give the first dose. Or if you're in the hospital, you inform the physician, the doctor right away. Please remember, naloxone is not to bring them to the conscious level. It's to increase their respiratory rate. The half-life of this medication is very small. It's 2 to 5 minutes. That's why you need another dose if their respiratory rate has not increased more than 10, and you will be not using the same nose or nostril. You'll be using a different nostril to give another dose, and you will wait until the 911 comes, and you can repeat it if you have more kits like this. The main purpose of this is to bring their respiratory rate to more than 10, and then you can go on and carry on with your care. But please remember, this also induces vomiting. There's a slight chance that they will vomit. So when I do the first dose, what I do is I put the patient in the recovery position, which is a side-lying position with the arms below to support their head and their body, and that's how we help the patient when there is opioid toxicity with the help of a magic drug called Narcan. Thank you for watching the video, and I'll meet you in the next video. Thank you.